Welcome everybody, those on site and those online. So my name is Mathias Dewatripont, and I'm very happy to present a talk on the importance of the Draghi report on the future of European competitiveness. And the Draghi report is all encompassing, but I will of course focus here on the case of pharma, which has a special chapter also of the in-depth analysis of the reports. The Draghi report is quite important. First of all, because Mr. Draghi is a very respected person. He's credited for saving the euro, whatever it takes, as president of the European Central Bank. He was Prime Minister of Italy also, and so he was asked to look at the evolution of the European Union and recommendation to improve it. And so let me focus first on the big picture before moving into pharma, because in a sense, the Draghi report is not really about pharma, and at the same time, it is also about pharma. So the problems of Europe today are not really linked to pharma. They're linked to other things like big tech and so on. But still, there are some worrisome trends, according to some. And so in that sense, it's important to both give the big introduction and to focus on pharma afterwards, given the audience. So the thrust of the Draghi report, and by the way, I've been talking to Philippe Aguillon and Jean Tirole, and some of these things are connected to the result of these discussions. But you can also see them as a simple summary of the main message of the Draghi report. So the Draghi report is saying, look, from 1945 until 1975, Western Europe caught up nicely with the US in terms of GDP per capita. Of course, you know, we started low in 1945, and therefore it's easier. So then for a while, we stayed stable at around, I think, 75, 80% of GDP per capita. At the same time, we work less and we enjoy life more than in the US, and so some of it is a choice. But since the mid-90s, and in particular the IT revolution, the trend has reversed, not just stayed stable, but has reversed, and the US is now growing twice as fast as Europe. And why is that? Well, I think it's natural to look at the famous Aguillon and how it works on endogenous growth. Basically, for Europe, the first 30 years after 1945 were easy. This was catch-up growth. You know, you imitate what others are doing better. And of course, we got some help from the US, the Marshall Plan. We had a lot of energy, cheap, and we had a good education system, and we caught up. Then came the first and then the second oil shock and so on. But the point is that after a while, when you reach the technological frontier, so the catching up is gone, then what you need is innovation economy. And the US has clearly done it very well with the IT revolution, information technology revolution, and now the artificial intelligence revolution. And so while in Europe, we have failed to put in place, according to the Draghi report, I think he's right, the institutions and policies that promote disruptive or radical innovation. Now, why? Let me see. How does that work? Yeah. No, actually, it's okay. Thank you. So, and here we will focus in particular, and it's a big chunk of the Draghi report, about how research and development differ between the US and the EU. And then gradually China is becoming a player again also. So first of all, looking at private research and development expenditures, well, Europe's is only half of the US, and it's mainly due to a composition effect. In Europe, much is in so-called big tech. More than 50% today of private R&D in Europe is the auto sector. And we can't really say that we are leaders in electric vehicles or stuff like that. In the US, 85% of private R&D is in biotech, software, hardware, and artificial intelligence, which are much more R&D intensive sectors. This is detailed in a report, Fust et al. All the references are at the end. The last author is Jean Tirole, in fact. And let me so coming from that report, the top 3 R&D spenders in the EU and the US, you see the EU, it's basically cars. Volkswagen, even in 2022, Volkswagen, Mercedes-Benz, and Bosch for the electrical systems in cars. And by the way, the market caps of these companies are below 100 billion, while Tesla is, I think these days, 700 billion alone. In the US, it was cars, and by the way, they have not done great. Ford and GM have not done great. They are, we could argue, worse than Volkswagen or Mercedes-Benz. There was Pfizer, so pharma. In 2012, there is Merck Sharp & Dohme, pharma. But you see software, hardware is coming. Intel, not doing great anymore, by the way, but Microsoft. And today, Alphabet, so Google, Meta, Facebook, and Microsoft. So you see, there is a transition that has happened. And again, market caps, they are in the trillions. These guys, while Volkswagen, Mercedes are not even in 100 billion. So, so we have this problem of composition. We also have a big fragmentation in Europe. We don't have a real single market. We have an unfinished single market. We have 27 labor laws, 27 procurement rules, much less centralized procurement from the public sector than in the US. We have 27 securities regulator, 27 electricity regulator, 27 pharma regulator, even if, okay, we have the EMA, like the FDA, but afterwards, we have national. So I'll come back to that. In terms of financial markets, we don't have a true capital market union for startups. NASDAQ has a high-tech stock market. We have much fewer venture capitalists, institutional investors. In most countries, in all big countries, we have pay-as-you-go pension systems, while they have pension funds in the US, just like in a couple of European countries, of the Netherlands, and some like I think Denmark and Sweden. But so we have financial institutions that are less willing to take risks and finance radical innovation. So therefore, we are in trouble, in particular in big tech. Yeah.
I don't know if it's the right time to discuss that, but I think I find this parallel of pension funds pretty bizarre.
Okay, let's not discuss that for this, because it's not at all connected to the rest of the, but let's talk about it afterwards, if I may. Thank you. Okay, that was private R&D. Now, public R&D, also problematic, too national, insufficiently focused on disruptive innovation, and with the wrong method to allocate the funds. And I will go back more into this when talking about pharma. In the US, public R&D funding is concentrated at the federal level. At the EU, it's mostly at the member state level. While the EU is a regulatory giant, more than half of our regulation come from the EU, but it is a budgetary dwarf because the total budget of the EU GDP is only 1% of EU GDP. which is a huge handicap as far as the key global challenges like the green and digital transitions are concerned. Okay, as I say, green and digital. These are the two key challenges, I think. We are not leader in digital, clearly. And in green transition, we have some problem. We have energy costs, things like that. Now, lots of things are very interesting in the Draghi report. I recommend you read the summary, a 60-page summary. But let me not focus too much on, I think, the last slide. Here, general recommendation. To remedy these serious deficiencies in the EU innovation ecosystem, the report proposes massive public and private investments in fundamental research and disruptive technologies, supposed by reforms to the EU governance aimed at streamlining decision-making, limiting the multiplicity of regulatory constraints, and putting the scientists and entrepreneurs in charge to allow for the emergence of promising new innovators. There are discussions about the trade policy and whether some kind of enlightened protectionism, some people say, are concerned, industrial policy and so on. Let me not discuss that. Clearly, there are hurdles in these recommendations because what the Draghi report suggests is to have hundreds of billions of EU money funded by common borrowing to do this. And not all member states are on the same wavelength. And therefore, I don't know what will happen. But let me zoom in. I think all what I've said about the assessment is correct. The question is, how can we find a political solution to move? Now, in a sense, I'll zoom in now on pharma, because there is a 20-page chapter in the detailed report on pharma, which I will summarize here. And as you'll see, things are different there. Because basically, the starting point is not bad. We are much better in Europe in pharma relative to big tech, of course, and even relative to cars, where we have problems. We don't have Tesla, we don't have the Chinese electric vehicle factories. But some trends are worrisome. So basically, the starting point, as I say, is not bad. The global pharma sector in the world is the fourth largest market, so it's a big deal. So fourth largest measured in net sales, third largest measured in overall profit. They make good money. It's a significant contributor to the EU economy. 5% of the value added to the economy from all manufacturing. Almost 1 million people directly employed by the sector, with indirect jobs probably twice as many. Growing, so 680,000 in the first quarter in 2008. Almost 1 million in the fourth quarter of 2023. And you know, increasing employment in the manufacturing sector, that's rare. Huh? So we are moving towards a service economy. So these are good jobs and growing. It's also, as we know, a sector of geostrategic importance, as demonstrated by the COVID pandemic. The capacity to swiftly develop, produce, and administer vaccinations was crucial in allowing the EU economic recovery. And so we managed to do it because we produce a lot of patented drugs. Generics is more outsourced to low-wage countries, that's normal. But so the starting point, we are credible. Now, we are credible thanks to a number of strengths. So we have strong positive net exports of pharma products. We have a strong manufacturing base, especially in countries like Belgium, but not only, for medicines under patent, and strong publications. So there we are okay. The problem is that we as European Union, we are falling behind in the most dynamic segments of the market. So biologicals, which is growing. So the market in the last 10 years, or well, 2012 to 2022, the market in total for drugs has increased, legal drugs has increased by 50%, biologicals by 150%. We are also falling behind on orphan medicines or rare diseases, where the sales have been multiplied, not by 1.5, like biologicals, but by 24. So we have an explosion of expenditures on rare diseases. Now, we have zillions of rare diseases and so on. They only concern a few people, but since the price is very high, well, budget-wise, and Draghi is not the first to say that. I remember Hans-Georg Eichler saying these kind of things. We have to be careful. These, while the disease may be rare, the expenditures are not rare. They are growing very fast. So, so basically, also we are also falling behind on medicines based on genes, tissues, and cells, so-called advanced therapy medicinal products, or ATMPs, and these categories often overlap. So there is a worry. By the way, we could add as worry the AI challenge, because AI is becoming more and more important in health. And of course, in AI, we don't really exist. So in comparison to the US. So, but the report is saying, look, why do we have problems? How can we do better? Well, it's coming back to the general thrust of the report. We need more Europe. We need lesser and less. No, we need more public R&D. We need less fragmented R&D. Indeed, our problems come from lesser R&D, public R&D, and fragmented public R&D. So, you know, there is good stuff, you know, in big countries, for example, the Max Planck Institute, they are good. INSERM is national in France, but only in France. So we would need more EU-wide expenditure. We also have less private R&D investment in the EU, both from listed companies on stock markets, even more for unlisted companies, private equity, and so on. And we have a weaker supporting environment. There are some nice hubs here and there, but not as big as around Boston in the US or around San Francisco. Increasingly, China also develops bigger hubs. So what we need is more money and less fragmented money. We also need simplification. We have a slow and complex EU regulatory framework. EMA is good, but after EMA, you have national health technology assessments. You have national pricing and reimbursement. And then we have the complex emergence of a European health data space. We need, again, so more Europe, less fragmentation, not to start existing because we exist, but to avoid falling behind. So, key recommendation, the report acknowledges recent EU regulatory progress in trying to fasten authorization of new medicines, in trying to facilitate clinical trials and use of data, and coordinating national health technology assessment work. But it thinks we should go further in these various directions. Among the most novel ideas, they recommend going towards a European-wide health technology assessment agency, and increased and focused public sector R&D investment, supporting a number of world-class innovation hubs in life sciences for these advanced therapies. By the way, NIH stands for National Institutes for Health. So they have it's a US agency that selects US hubs. So now, this was the summary. I don't know if there are some clarification that are needed. Sorry, Michael, I hope I haven't frightened everybody by saying we should discuss that later. But this is indeed, I will not say, I don't say almost anything about finance. So, yes.
Yeah, maybe a comment about, you said EMA is good. Well, I would like to moderate this because compared to the FDA, EMA is behind. They don't take risk. They cancel a lot of products which are accepted by FDA and not in Europe. And the reasons are not clear because they mix two, essentially they mix two things. EMA is supposed to say, okay, the drug is favorable, there is some risk as ever, but if you don't take risks, you cannot progress. But they said, oh, but the drugs will cost a lot. That's not their role. It's another phase. And they mix it. And the result is that I know at least 3 drugs which have been just accepted by FDA, even by UK, even by Japan, China, Saudi Arabia, and Israel, and not in Europe. I don't think this is a progress.
Okay, well, thank you for this comment. When they talk about EMA, they say, look, in that area, at least we have centralized. And therefore, you have authorization simultaneously in 27 markets.
Or refusal. Or refusal.
Then they are saying also, but we can come back to that. We can come back to that. Indeed, they are also saying, and maybe I was too fast, sorry about that, that they want indeed to accelerate the approval of drugs. And maybe they are saying, look, you know, EMA should be less risk averse. It is true that the way I read it is that they think that the most progress can be achieved through avoiding all these national regulators. But I take your point. Let me maybe come back at the end about, you know,
fragmentation still exists in EMA.
Sorry? Fragmentation. Okay.
I was 3 years as an observer in one of the commission of EMA, and you have a report from different experts. And you know, the opinion of the experts depends on his culture.
Okay.
And when it is Italian or Netherlands or others, the evaluation is not the same. So to take that it is not fragmented, I have some reserve.
No, I take the point. By the way, this will be one of my comments. So now I'll come, well, to be fair, given the urgency, I went back to some stuff I had done before the Draghi report and tried to connect it to the Draghi report, and this is what I will do now. The one thing which strikes me when talking to industry, patient organization and the like, the view is always, okay, we should approve faster, we should approve more, and if needed, it will cost what it will cost. And well, you know, if you spend a lot of money on some of these things, well, this money will need to come from somewhere. And by the way, the Draghi report is in the same thing. We need to approve faster. We need to get rid of the hurdles and so on. I think the elephant in the room, the Draghi report is very favorable. I mean, sees the US as a model. Well, the US sucks. Huh? The healthcare system in the US is a disaster. It costs a lot more than anywhere else in the world. And their aggregate health statistics are pathetic. Now, it's not necessarily due to the pharma part, which, by the way, is only a moderate part of the total budget, and so on. It's also due to the fact that they don't treat poor people well, and they have a huge infant mortality and these kind of things. However, it's also true that there they are saying, look, our system is so much worse than in Canada and Europe. Our prices are huge and so on. So, you know, they are completely, the system there has been captured. And I think if I had been, and now I'm taking my hat as a kind of a commentator on the Draghi report, I found it funny that they didn't start from the point of view, you know, this is about optimizing the innovation access trade-off. And there, one thing you may have noticed, when they talk about what has happened recently, they don't mention joint procurement of COVID vaccines, which was a huge success. Yes. So the idea, of course, it's a report on competitiveness. So of course, they want to help industry. But come on, industry is there to help society. And the question is, to what extent are we doing the right thing? And I will come back to the FDA and so on, and what the FDA could do better. Because a lot of the stuff that the FDA is approving are Me Too drugs that are then super expensive and allow you to make a lot of money. But maybe let's wait until the end so that to have a discussion, because I see it's already almost 1 o'clock. But let's come back when I will have discussed the various aspects. So what I'm going to do is talk about earlier work on COVID, including vaccine and vaccination, and on rare diseases, and then compare a bit our conclusions with what the Draghi report is saying, and to see where we fully agree and where we could respectfully differ. So, but okay, so COVID vaccine episodes. So we started with Philippe Aguillon, Sophia Nahal, and Michel Goldman. We wrote a little piece in 2020, arguing in a sense exactly what the Draghi report was saying, which is, look at BARDA, they did a wonderful job. So now successful, as I say, successful vaccination requires, as people say, vaccines don't save lives, vaccination saves lives. So you have a number of steps: R&D, authorization, production, purchases, delivery, and persuasion. Now, and I want on R&D, just I think it's a great example of what the Draghi report is saying, trying to say. The US is the leader. Please imitate what they are doing, in a sense. Huh? So they have a very impressive ecosystem, very good research universities, the NIH financing national hubs, BARDA, which is the Biomedical Applied Research and Development Authority, biotech companies with very effective financial markets, Michael, and big pharma. So they have all that. Not that we have nothing, I'll come back to this, but, and they have indeed, they use the benefits of centralization with Operation Warp Speed. By the way, they recruited a scientific officer, a graduate of ULB, Moncef Slaoui. They have the Defense Production Act. They also have, by the way, a US Army. We don't have a European Army, so they could use the US Army to help. And what did they do? So they had a lot of money, 2, 4, 6, 7, 8, you know, more than $10 billion. And they concentrated their expenditures on 6 projects. We almost all know them. BioNTech, Moderna for mRNA, Johnson & Johnson and Oxford AstraZeneca for viral vector technology, and then Novavax and Sanofi GSK for protein subunit. They are less well known because they came later, and so it was clearly 1, 2, 3 in the end. So interestingly, they concentrated on 6 projects, but they also diversified 3 technologies and 2 projects per technology. And by the way, even though it was US public money, each time 1 project was European, BioNTech, AstraZeneca, and Sanofi GSK, and 1 was American. No, Johnson & Johnson, indeed, Johnson Pharmaceutical is Janssen. So indeed, they were ready to go global and not defend only US champions or French champions or whatever. By the way, it has been hugely successful. Huh? We always say, you know, the public sector is unable to pick winners when they picked winners. Huh? So, because indeed all 6 has been authorized in the EU and all the US by the FDA and the EMA. So, interestingly, they didn't go just for the big players. So the big boys of vaccines pre-COVID-19 were GSK, Sanofi, Merck Sharp and Dohme, and Pfizer. And by the way, Pfizer, people talk about the Pfizer vaccine. Vaccine specialists talk about the BioNTech vaccine. So Pfizer only came later to help produce, which was good. Huh? You know, there was production was more professional than AstraZeneca's, which were not vaccine specialists. But you know, interestingly, the main winners, in a sense, even though AstraZeneca saved many more lives in the world than the mRNA technology, but basically they gave a lot of money to biotech firms, Moderna and BioNTech, which then teamed up with Pfizer. Moderna, we don't even know who produced. By the way, Moderna, it was their first product. Huh? So, and I think there is a Swiss company, Lonza, that helped produce. But so Pfizer, in a sense, had the same role as Lonza. So
if you allow me, they started in fact more than 10, 15 years ago with Libre cancer.
No.
That's where the whole technology was developed.
That's what indeed I'm saying at the end. Renée de Veugelers, who wrote an interesting paper on the mRNA vaccine, she says, look, you know, we were lucky that mRNA technology was kind of there. And indeed, the idea that within a year you get 6 vaccines is just amazing. Huh? So we all agree. But BARDA was very, very important, and therefore, and it's the same as in the US. In the US, they have DARPA, Defense Applied Research Project Authority. They are credited to have played a role in the advent of the GPS and internet even. Okay, CERN was very important, but DARPA helped too. So clearly having this centralized authority ready to take risks, focus, but diversify and make sure competition works. I mean, this is almost a dream for those who like industrial policy.
Can I make a small comment? Because you did a very good seminar with Agion, you, and someone else explaining the RAP technology, and Slaoui, and he said, I had the full chèque en blanc.
Yeah, full authority.
I do everything by myself. I don't have a lot of commission saying yes, but this and that. I decided alone, and I did it on the same level. You know, I didn't wait for phase 1 to move to phase 2 and 3. I did it all together. That's what accelerates the system.
Well, I don't think he had authority over the FDA. But by the way, the FDA and the EMA did play their role.
They play the game as
Yeah.
well. Huh?
So, no, clearly.
FDA and EMA, I know quite a lot of people there. From start of COVID, they work together day and night, Christmas, New Year, and they evaluated during phase 1 already the project and everything in parallel. And but unfortunately, MEA has been obliged to stop that clock.
Right.
And there's no COVID anymore. There's no
Okay.
So we can discuss about that.
So lessons for Europe is very much compatible with the Draghi report. We do have strengths, especially if you add to the EU now, the UK and Switzerland, let's face it. Good research universities, good biotechs, good big pharma. Need for more cooperation to emulate the NIH, hubs and so on. Now, BARDA question, will HERA be up to the job? Definitely don't have the same amount of money. So the Draghi report is right. And then, of course, if a crisis comes, what about European Operation Warp Speed, Defense Production Act, and so on? So, but that's for not for pharma per se. This is for infectious crisis. So hopefully we won't have another COVID in the next 5 years. We never know, but so in a sense, this stuff is not needed for pharma today on rare disease and the like. Now, this is not. Yeah. Then on purchases, and there I want to bring the cost part, where they say the Draghi report is silent. Who managed to purchase fastest? Israel. Not because they were involved in R&D, in production, just because they pay more. These companies, they sell to the highest bidder. They are for profit. You can't blame them in a sense. Huh? By the way, Israel also provided a service to global knowledge by allowing Pfizer BioNTech to analyze in detail the impact of vaccination on the Israeli population. So that was nice. Now, the UK and the US benefited from close links to AstraZeneca, respectively, and Pfizer and Moderna to accelerate purchases. And the EU, they were slower. And for a while, von der Leyen was criticized for that. But that's because she pushed for a European approach. And indeed, when you see here, the percentage vaccination, you see that the first is Israel, starting in December 2020. The second is the UK, then the US, and then European Union, which was a bit slower. And after June, started coming in the let's say vaccine hesitancy constraint and so on. But basically, I think that okay, these numbers about vaccination, they depend on whether you manage to buy them, whether you can organize delivery, and whether you convince citizens to get vaccinated. So I don't want to spend too much time on this. Israel was great to buy them. There was great also to organize delivery. They're very efficient. They were less great to convince citizens because, Arab Israelis or religious Jews were less convinced. The US was okay to organize delivery, was poor on convincing citizens because it became political with Donald Trump and the like. Yeah? And so it also hurt in their non-pharma intervention. The EU, I think they were slower on purchasing because they needed to agree. While at the beginning, a quatuor of countries, Germany, France, Italy, and the Netherlands, had decided we'll bargain together. And what the hell for the rest, huh? So as I like to say, there are so many of these vaccines that have been produced in Belgium. As a Belgian citizen, I'm happy that Ursula von der Leyen came in and said, look, you know, it's for everybody here. So I think that's okay. It delayed things a bit, but this was helpful. And this picture, which is basically saying, look, what is striking, and it's most EU countries, the biggest EU countries by population. What you can see here is that it was very concentrated, the progress in vaccination among most countries. Now, one country was a bit faster, and that was Hungary, because they had bought some Sputnik vaccine, but that was different. And then some countries are less good at organizing things. Bulgaria, Romania, Slovakia, Croatia, Poland. But I think the fact that, and then it starts becoming less concentrated because the vaccine hesitancy constraint comes in. You know, some countries have more hesitancy than others, and that's something else, and not for today. I think the point I want to stress here is that, okay, it's understandable that the EU Commission was criticized for slow delivery of COVID vaccines in the beginning, because I think it insisted too much on low prices. Without, as an economist, you have always to compare the costs and the benefit of urgency. You know, it was so costly to the economy not to be able to vaccinate people that it was worth maybe a higher price. So in the end, though, thanks to the Belgian Secretary of State, we know what the prices were. So we paid. She's now the president of Open DLD, I think. Yeah. But so the EU managed to get low prices, less than 4 euros, 24 euros, and 36 euros for 2 doses of respectively the AstraZeneca, Pfizer-BioNTech, and Moderna vaccines in the contract signed by the Commission and leaked by our Belgian Secretary of State of Budget. Against for Israel between 38 euros and 81 euros for 2 doses of Pfizer-BioNTech vaccine. Now, as I say, it was maybe profitable for Israel to do that. Maybe the EU should have accepted, in this specific case where urgency was so important, higher prices. But the point is that there was an innovation, which was the idea that we would centralize. And facing worldwide companies, you know, I think it's useful to have centralization to counter pharma companies' attempt to play countries against one another, which has been well documented, for example, by Margaret Kyle. And the Draghi report says, look, you know, countries with bigger budgets get drugs faster. Okay, getting it faster is a plus, paying more is a minus. So you have to make a balance. So that's the only thing I'm saying. So, so coordinating purchases, I think, would improve bargaining power on the buyer's side, as far as this trade-off between price and speed of access is concerned. And this idea of joint procurement, so the buzzword is joint procurement at EU level, is, I think, generalizable to new medicines more generally and to other economic sectors also, I think. But here, let's keep focusing on, yeah.
One of the problems that we had at the time, and which we still see now, if I understand, is global shortage of production capacity. And so how much time did we actually lose doing that? Because, you know, even in the US now, you have many drugs which are, I mean, they have shortage problems with many drugs, despite the fact that they pay the highest prices on the planet. So a year or two ago, I was thinking indeed it's just a matter of paying high enough and you get your stuff, otherwise not. But now it seems that we need to increase production capacity in Europe. That seems to be one of the main problems.
I think it depends. I agree with you that we have to be careful because building production capacity takes time. Demand can go up and down. So there are, my point here is that this idea that countries end up paying more because they are competitors, that has led to a number of sub-regional alliances like Benelux A and the like, which we'll come to. And so my view is that in terms of optimizing the trade-off between innovation and access, this joint procurement was a success.
No,
and I'm surprised that the Draghi report is
I agree. After 5 months or 6 months, we were ahead of the US in terms of vaccination rates.
That's because the US had some.
What was the actual?
Well, I think that the problem was we had reached by then the persuasion constraints. I think, but indeed, I think it's a valid point. No conclusion about COVID vaccine experience and Draghi report. As I say, the COVID vaccine innovation completely validates the conclusion of the Draghi report. BARDA was excellent, now called ARPA Health, and the whole US innovation ecosystem is to be stimulated, to be emulated. I mean, as a first order of approximation. I wouldn't, okay, one exception, this idea that getting a college degree in the US is so expensive, that's stupid, I think, because the US, they have the best universities in the world, they educate the elites of this world, but at the expense of not really educating enough people from the US, and that's bad. So in that sense, even though ULB has many students, maybe too many, I think there is societal value in making sure we educate our population. Anyway, but beyond that, as I say, their innovation ecosystem is very good. On the other hand, it's surprising that they don't mention the joint procurement innovation undertaken by EU Commission. We need more EU there too, especially in order to control public expenditures, which are under stress, huge stress today, given the combined cost of aging, the need to build up our defense, and the digital and environmental transition. So this is a moment where every euro needs to be spent properly. And therefore, let's avoid leaving money on the table. Okay, so that's what I wanted to say about COVID vaccines. Let me now move to the rare diseases, orphan diseases. And basically, there will be some similarities. Now, and remember, in the last 10 years, the budget for drugs has gone up by 50%, for biologicals by 150%, so multiplied by 1.5. For rare disease, it has been multiplied by 24. So this is becoming big. So that's thanks to, at some level, it's great, the progress of science, gene therapies and the like, wonderful, but it's costly. So the EU Commission has been working on these issues, was already mentioned, pushing for more competition through fine-tuned intellectual property rights, linked to access to the whole EU, to innovation related to rare diseases or antimicrobial resistance, area where also innovation has stalled, pushed for more transparency on costs and prices. All these things are helpful. But you know, when you look at the stuff that has been that has been authorized, approved by the EMA, the FDA. Well, this stuff costs a lot of money, and therefore budget times 24. So, and we are still very, very far away. Is it true that it's only 5% of the rare diseases that have a treatment at this point? So if you multiply by 24 times 20 because you only have at 5%, you're in trouble.
But it's not fixed price, it can change.
It can. Typically, I mean, a lot of people are saying, well, these are things that stick to the mind, and then they are basis for the next thing. So that there is some, now, some people around the table know more the data than me, but, and of course, and some of it is one dose and it works for life. And there are lots of arguments. However, the bottom line is it's growing, it's useful, but it's very expensive. So we need to think about the sustainability. Ways to look at how to make it more sustainable, and that is coming back a bit to your point about the FDA strategy. I think it's important to think of ways to improve the trade-off between innovation and affordability in a world where it has been documented. Big pharma earns a lot of money. And there is a paper by Andrew Lowe and co-authors, famous professor at MIT and co-authors, saying that, okay, biotechs, it's so risky that on average, their so-called risk-adjusted return, which is what people in finance use, is okay. But big pharma, they make a lot of money, so they use their monopoly / oligopoly power. And one idea, some of it seems to be targeted not necessarily towards the most useful innovation. There is again work by the team of Andrew Lowe, so whose last author, Fojo et al., the end is Lowe, showing, I mean, it's a very clever thing. It's for cancer therapies in the US. The FDA can give you a fast track authorization if what you're doing is really ambitious. Now, we like ambitious stuff. Now, interestingly, they compare how much money you make in the end on the fast track versus on the slow track. The slow track is more like a bit like Me Too innovation or stuff like that, more marginal. Well, it turns out the more marginal is much more profitable. Now, that's not great. So in a sense there, I would maybe slow down a bit on the marginal so as to redirect innovation efforts towards the really creative, because this is the stuff that will give you more health benefits per innovation.
So for this, we agree that the EMA should be given more powers to block new drugs when they are expected to be too pricey, if they are not fundamentally
well, I mean, now interestingly, I mean, this is coming back to this is coming back to Roland's point about the EMA should not start talking about prices.
It's not their role.
I think it is not their role. On the other hand, I'm a bit worried. I must say, in that sense, maybe I'm sharing what Miguel is trying to say, which is that once a drug is approved,
yes,
then comes the lobbying to say, look, you have to make it available. And then the company says, that is very expensive, so I only agree to make it available if it's very expensive. And then we are. And, you know, this sequential, so in a sense now I don't have a view, I'm agnostic on these things. I mean, I'm just saying that we all agree that we want a good combination of innovation and access. And by access, we should keep in mind that if the budgets are completely blowing up, this won't be sustainable.
Okay.
And therefore, unless for people who are very rich, but that's not what we want. So I think it's very interesting debate, and so let's continue the
go back
debate.
to the Draghi when he said we should innovate and we should copy what the US does because they have a good example. But when you look what EMA is doing, they are not following FDA. That's what I put on the table.
So what's the trade-off for you? More in medicine, giving the EMA also, a color. Technically, you're good. Pricing, we give agreed, but
not to give authorization to EU to use a drug for clinical trials or whatever is a step behind compared to the others. That's what I want to raise.
So I don't know whether you presented this one to which I'm responded, but my whole life in vaccines, and from time to time I work or I have contacts with Michel, so we close.
Now, I take the example of ECARES, which has been agreed by the whole world except EMA. So I think I don't understand.
On access business.
Yeah.
Okay, you know what? I'm just being told. I was looking at how many slides I have. Only have 5 or 6 more slides, so I will maybe do that because there are also questions online. So and it's already 1:27. So okay, now so as I was trying to argue, it's worth exploring the view that, of course, we need more subsidies for research, and ideally in the EU, at the EU level, to go for the best hubs. So let's agree on that. We need more subsidies for research. We also may want to have some stricter regulation on what it takes to in terms of innovation for new therapies. Just like for patents, you have to be new and non-obvious. There is an issue of the threshold. The question may be indeed, more authorization is not always necessarily better. So we need to see to what extent, ideally you want indeed to kill 2 birds with 1 stone, i.e. discourage marginal innovation in order to raise the incentive to engage in truly innovative research. So now then coming back to the joint procurement or centralized processes, centralized purchases, just like with COVID vaccine, it would make sense to coordinate bargaining at the EU level. I think it's relevant for rare diseases also because one of the reasons why the price is high is because you have too few patients. So in a sense, all of a sudden you would have patients from the 27 countries. And getting lower prices is even more important here than with COVID vaccine. But with COVID vaccines, urgency was so important that maybe a higher price was okay. And that would build on alliances between member states. I think member states agree that indeed joining forces can help. Benelux A, the Valletta group for Southern Europe, the Visegrad group for Visegrad countries, the Nordic Pharmaceutical Forum. You need to include France and Germany, and you're kind of there. That I think is, again, an avenue worth exploring, and I'm a bit surprised that the Draghi report doesn't mention that. Yeah.
Then I have a fundamental question. European level, the ultimate power is at the council. So when you see that, unfortunately, the evolution in many member states, I'm afraid, really afraid about the future. How can we, first of all, start to come back to a European spirit to a generation which is happy by Europe, etc., etc. Ask to people who are 20 years old about the history of Europe, but this is fundamental for the future.
No, no, I fully agree here.
I think it's basic to reverse that movement. All the rest will fall down if every country and if every region goes for itself.
No, I fully agree with you. In fact, I'm just saying here, but I'm politically naive. I understand, given how things have evolved. Indeed, at a time of crisis, COVID crisis, Europe managed to join forces. And the question is, how do you make this structural? I think Draghi is trying to do it. Right. He's already much more respected than I am, and rightly so. I'll see whether his political capital will be enough. I have my doubts. I agree with you that the right now, you know, even if when Russia invades Ukraine, we are not able to join forces as Europeans, we can be pessimistic. I agree with you. It's a political question, and this is only Health Innovation Seminar. Yeah.
I don't know if it's the right time to answer McDonald's online question too.
Okay, so what if I finish and then we allow the online and then we go back to. So, okay, here is trying to say, look, you know, indeed, the centralizing purchases would make a lot of sense, especially for rare diseases. Again, these are kind of Draghi consistent coordination ideas. So to conclude, last slide, and then I open the floor. The Draghi report rightly calls for more centralization in public R&D in pharma and the organization of clinical trials, in particular for rare or orphan diseases, where the EU is now lagging behind relative to the US. In this area, however, with public expenditures rising very fast, two very natural avenues to improve the trade-off between innovation and access would be: one, fine-tuning regulation in order to incentivize true innovation, and favoring joint procurement as for COVID vaccines. So this is maybe where we can open the floor. Sure. Now, Michael, are you ready to wait for the after the?
I have to.
You have to. Okay, he has to.
So first we, yeah.
Okay, no, I don't want to shut you out, huh? So just to allow the online audience to.
We had a comment and a question from Mathias.
Yes, Mark. We see you.
Okay.
And we hear you.
So thank you very much, Mathias, for your excellent talk again and again. I have just two things. The 5% of rare diseases that can be treated, I disagree. That is not true. 5% means that you only can treat with authorized orphan drugs 5% of the rare diseases. We do not do that. To prevent, to diagnose, or to treat rare diseases, we use a lot of non-orphan authorized medicine and products. We do a lot of radiotherapy. We do surgery. We use devices and all that. So the 5%, it is not true. And the second point I would like to say is about the joint clinical assessment. Most probably you know what that means. And the idea was to improve the access to orphan drugs and ATMPs. Don't you think that really would give more access to these products with the GCA, please?
I'm not sure I understood what is the last thing?
Well, joint clinical assessment. It's a new idea that will become reality the 1st of January 2025. So it
Okay.
means that there is a joint clinical assessment of the 27 EU member states.
My God.
Okay. And now I think the Draghi report mentioned this as one area where there is progress. I must say I have no special expertise on this and how this would be organized. In principle, to me, it seems like a good idea, but I don't know whether others have views on
Is it an
the
act?
whole long.
Is it an act or directive from EU?
Is it a directive or a regulation or?
I don't know. I don't know.
They
But
have
it will
to-
become effective the 1st January. That's absolutely sure.
well,
Because I think what Roland is trying to say, I think, because I've had a lot of debates on this in another sector
okay,
I look at, which is banking. The problem of directive is that it still has to be
exactly.
Yeah.
translated into
Yeah.
national law everywhere.
Yes, exactly.
So we are not there yet. But in principle, let's try. Thank you.
Okay, thank you.
Then we had another question from Jean-Pierre.
Thank you. First of all, congratulations with a wonderful analysis and presentation. It's also made me think about what Mariana Mazzucato is saying and researching and commenting a lot on missions and on the value of everything in her book, The Value of Everything, where she talks about value extraction and value creation in pharma. So there's an alignment with what she is saying and doing in also saying that there needs to be more public innovation and public R&D, public funding. So you see an alignment with the Draghi report on that?
Yes. So, and I know, of course, Mariana Mazzucato's work.
Yeah,
and indeed, I think there are similarities between what she's saying and what the Draghi report is saying, and I agree with that somehow we need indeed, in particular in the EU, a bigger push in public research and in strategically oriented research. Now,
yes.
she did missions. At some point, the EU was talking about grand challenges. And I fully agree that somehow, and with Philippe Aguillon, we've done some work, and Patrick Legault and others, showing that indeed, if you direct research towards some joint topics where there is more competition between the firms, you end up with bigger value in terms of innovation. Then, when she says, look, be careful about who generates innovation and who benefits from innovation, it's the old Marxist idea of socializing the losses or the costs and privatizing the profits.
Yeah.
We have to be careful indeed. And at times it happens. Now, I think that, of course, the problem in pharma is that clearly there are some cases where too much money is obtained by some companies too easily. And therefore, that's part of the idea that I was pushing also in terms of optimizing the trade-off between innovation and access. At the same time, let's also face it, there are some areas where the potential of profit isn't there, given the cost needed, and therefore not enough is happening. Yeah? So when companies, antibiotics, there is little action. Alzheimer's disease, some companies are stopping. So clearly there, we need more public money to make sure it happens. But of course, at the end, you need to make sure that that the gains are shared fairly, and that you don't have super big profits happening. And so, you know, it should be profitable enough so private companies won't make losses, so they won't agree to that forever. So at the same time, there is no reason why they should make tons of money if it's not needed. So in that sense, I think Draghi, Mazzucato, and us, we are aligned.
Yeah, yeah. Thank you.
Thank you.
Then we had another question from Géraldine Faucheux, but she cannot speak live, so I will ask the question. Regarding joint procurement, how would you envisage its governance? I would personally be afraid of decision delays that would impact negatively the timing.
Well, I think that in a sense, what happened with COVID vaccine is a good example. And where I would argue in the end, the Commission performed very well because they had to set up the first joint procurement setting. It was not perfect. It took a little while, but you needed to first convince the 27 member states. Of course, if you had the structure ready, I think the delay would be reduced. And of course, you need to make sure that the right interests are represented, that the trade-off between access and price is optimized. So I think it's not super simple. At the same time, I think it's better there to do much better than the US, where at some point in 2006, I think George W. Bush told Medicare, look, a drug under patent is a monopoly, so accept the price they set. I think we can do better than that. We already do a lot better than that in Europe. The US is of course an exception there, and definitely not to be followed. But I think, as I say, bring together the people responsible from Benelux A and the other, and try and make sure that we have a dialogue between these funders, and you know, it was doable under COVID, so why not for other drugs in general? So yeah.
And one last question from Georges Siotis.
Hello, Georges.
Bonjour. I had one comment, and but now I'm listening to the discussion. I have actually two questions. Just one thing, Mathias. The EU is not playing around with intellectual property rights in the pharma proposals. You know, patents are sacrosanct. They will not touch it. They are playing with data exclusivity and a period of market exclusivity. So, you know, just it's not playing around with patents, but it's playing around with some regulatory protection, which is de facto the same thing, but it is different.
Okay.
Now,
thank you for that precision. Sorry if I expressed myself badly, because I was not at all saying that they were playing around with patents. But,
no, it was just no. My question, you know, I'm kind of very ignorant about the US and how it works. But if I understand correctly, the NIH plural, they produce a lot of patents. Of patents of innovations. They can patent stuff, and I think there was a dispute between Moderna and the NIH about whether whether Moderna was using a patent produced by the NIH. It was not a question about royalties, but I think it was a question of principle. But my question is, and also to the people who have a link to KUL, how do these public institutions manage their patents? I mean, are there cases where the NIH is is asking for substantial royalties, or it's just pro forma so that their contribution is recognized? Same thing for KUL, because a few years ago when I was working on the Greek crisis, I looked at the ecosystem, the innovation system around KUL, and I was surprised by the amount of patents they were producing. So my question is, how do public institutions get some money back, if any?
I must admit, I'm not. I don't have anything very intelligent to say as an answer to your question. Can I? You need your or Shiri or whoever. And you started before, and then this gives you time to decide who follows.
I have a small experience, limited experience with some public institutions like universities or CERN, where they work on a percentage on royalties, and in some cases there is a lump sum which is paid to start, and then it's in fact a normal contractual procedure. That's the experience I have, on condition that the industry is interested in what they patented and invented. But normally it's a normal legal process.
Okay.
That's my.
Hilda and Shane?
I can just say that in the specific case of the NIH, in the specific case of NIH, they were both funding the patents, but they were also actively working on the innovation. So they are co-patentees. So it's from an NIH lab in collaboration with Moderna. So they, in this case, it's like shares. Yeah, more than the usual royalties that can be charged by like a public funder.
Okay.
Thank you.
Are there more? Yeah. So we are done with the online questions. And now back to Roland and Michael.
Okay. Just a comment about AI. We are well behind to say we are nearly nothing about AI in Europe. I think one of the main problems is that we don't have our own protected server, which can, because the conflict is with the protection of data. For AI, you need big data, and sharing the data is a problem. And I would say I'm ready to share the data of my neighbor to make a resume.
Yeah.
And but of course, there is a conflict between the protection of data on one end and the consent to share the data. And until we don't solve the problem and we don't agree to have the highest security for protecting the data, we are stuck. And I would also say that, well, but the governments, for instance, the French government, has agreed that all the data are at the social security, so everybody can have data from social security. But it is under Microsoft, and Microsoft is submitted to the Patriot Act. What is the Patriot Act? It is a Patriot Act said by the US government. If we want, for security reasons, to have the data, you have to provide it. So there is a big problem still to progress in that matter.
No, I think it's an interesting, again, I'm not at all an expert on AI, but indeed the frontier between nice principles about national security, privacy and so on, and how we can use this strategically to further one's national interests is, of course, very hazy. And if you start from a position of extreme imbalance between the strength of the US and the weakness of Europe, we're in trouble. Yeah.
Well, then I have a question. So I'm involved with quite a lot of European projects, and every time I have to go to the SharePoint, go to Microsoft, etc. Just a question or a suggestion: would that not be one of the very important principles that the EU please tries for all this innovative data, at least to have its own system, to be sure that at least the data, if there is no misconduct, if there is misconduct, you can do nothing, but that normally all these data stay within Europe. Because having said that, I think on the point of innovation, we must not be ashamed. On innovation, I think we keep the track with all the best centers in the world. But when it comes to translation, then the good researchers, they move very quickly to Boston, to California, etc., etc. There we have a fundamental problem.
That's what's in the report.
Yes, and how can we solve that? And the last point I want to make, I had in the last years the privilege to work a little bit on BARTA projects and on HERA projects. And when I am a strong supporter of
HERA, you mean
HERA, the health,
HERA, okay.
Our HERA here, 5 or 6 billion euros. But by the way, they are picked from other organizations, so there we have already a problem. But when you see the procedures to apply for HERA, you are 100 candidates, there are only 5 that will be successful. BARDA, it's the way around. You have something, you knock on the door, and then in 6 months you know whether you have funded or not.
Yeah.
So there we have, I think, a conceptual problem where in Europe we are very strong at regulating and following all these procedures. I know today they cannot do differently, but we must find a way around. So when COVID came, there was an urgency. No rules, for example, very well placed. The GMO rule for vaccines was put on hold.
No, indeed. Fully agree.
No, I stop here.
And the Draghi report is very much aligned
Exactly.
with what you're saying. Okay.
Maybe last question. How, with respect to the conclusion of going to European HTA procedures, how to see Europe as you have the examples of Benelux, Valletta, Nordic Pharmaceutical Forum, because there are so much contradictions between North, South, East, and West. How much Europe is there?
Well, I fully agree with you, and it's a big issue. You know, Bulgaria is not ready to pay the same prices for drugs as Germany or Sweden.
They cannot.
They cannot. Therefore, pharmaceutical companies will not approach.
At the same time, I think with joint procurement, you could combine this in a sense. I mean, one problem, one of the many problems in the pharma market in Europe is parallel imports. So, for example, prices are higher in Germany than in France, because France think, you know, we need to control budget and so on, especially with their exploding public debt. And then what happens is that some people say, haha, we'll buy stuff in France and export it to China. Which of course, it's almost lose-lose, because in a sense, there are shortages in France, and in any case, the German taxpayer pays high prices. Now, could it be possible to say, look, let us have a European price, but let us combine it with de facto help from rich to poor countries? It's called the structural funds. It is, you know, you have at least 25-30% of the EU budget. Okay, still EU budget is small, 1% of EU GDP, but still a third of that budget going from you know, countries like Belgium to Bulgaria and so on. Huh? So now, could we maybe say, look, we will have the same prices everywhere, but we will give you block grants that will, and the advantage then is that everybody is getting the stuff. So I think, and then at some point, maybe Bulgarians will say, look, you know, some of these drugs, we don't need them at this point. So they are not forced to swallow them and get some money. I don't know. I mean, I think some thinking out of the box might be useful because right now the system is not working.
I find it an ideal system, particularly from a humanitarian point of view. And then with the lessons learned from the history even still today, how to translate that and something that the European citizen can again start to adhere on it. Because when we lose that, so that's so, and this kind of thing with here in Belgium or in every country where you go, you see public investments with the flag of the European Union. And then you see people voting 50% against it. So so how can we market that?
I agree. By the way, on this front, and of course it's getting close to 2 o'clock, but I was once struck when you ask, probably 10 years ago, but so I don't know whether it has changed, but when you ask American citizens, what do you like about the federal government? Their answer is Social Security, which is their basic pension, and Medicare, which is their budget for health budget for seniors. And so indeed, what they don't say, we like the US Army or whatever. They say, we like stuff that the government is doing for us. And in that sense, that's exactly what Europe is not doing. Because Europe, okay, you're right, here and there you can see this bridge was built by Europe and so on. But if you don't cross that bridge, you don't see it. Now, Medicare is much too expensive because they allow companies to make too much money there. On this, Trump and Biden and Harris agree, by the way. But I do think trying to make sure that Europe is indeed seen as helping average people might be helpful there. So,
but I realize it's not an easy one. But and another point I want to make for health and food, sovereignty is important, just like for defense. I see almost all these three together.
I agree. Now, on that front, the current situation is not so bad because indeed, as I say, except for generics, we produce the stuff at home, mostly. The question is, some trends are worrying, and so we have to be careful with biologicals, orphan drugs, and so on. I think it's time to stop, no? So thanks to everybody listening online. Thank you for the interesting discussion, and I hope you enjoyed it.
Yes.
Thank you.
Thank you very much, Mathias.